Medical Masterclass is taking a field trip. I'll see you inside the endoscopy suite. In today's class, we're going to be talking about colonoscopies and how we utilize colonoscopies to help prevent the second leading cause of cancer-related deaths in America. By performing these procedures, we help prevent colon cancer. In order to better understand what a colonoscopy and how it helps in preventing colon cancer, let's have a look at the anatomy. This is the picture of a digestive tract. And here we can see how the colon is within our body. And these are the segments that we're looking at, being the red area over here of the large intestines. And that's what a colonoscopy is doing. It's going inside the colon while you're asleep and sedated, so you don't feel anything. And it's looking at the colon lining and helping see if there's any polyps or abnormal growths that happen in your colon, which can sometimes on occasion develop into colon cancer. And that's the idea. We're looking for polyps to help prevent colon cancer. Colonoscopy is very good in being able to look through the lining of the colon, but there are other subtle signs that you should always be looking out for in your daily routine. And one of that is ensuring that your bowel movements are consistent and the caliber and the shape of the stools are consistent with what you're used to. And so anytime there's changes in the caliber of your stool or the shape of your stool, but more importantly also if there's any changes in the colors of your stool, whether it's red, yellow, floating to the top, these are all questions that you should speak to with your gastroenterologist and feel comfortable knowing that that's something that we're comfortable speaking about. So this is the main event. This is a colonoscope. And a colonoscope is how we introduce the camera and be able to look inside your colon to look for polyps. Here we can see how it's a very detailed and pretty remarkable technology. On the distal cap, you can sort of see the camera, the high definition camera. We have ports to allow for instruments to enter and exit through this channel, but also we have light to help us view things in the dark, and also ways to allow carbon dioxide to stretch the colon and also suction the colon while we're going through the colonic walls, so that we're able to complete the procedure seamlessly and without discomfort. Amount of accuracy that we're able to get by being able to target the polyps and remove them is pretty amazing in how we're able to accomplish it with this new technology. Now we're going to talk about common misconceptions around colonoscopies. Colonoscopies are painful. The vast majority of colonoscopies are painless. That's false. We don't have to worry about having any discomfort during your procedure. We work with an anesthesiologist to help make sure that your procedure is seamless, painless, and without any discomfort. You don't need a colonoscopy if you have no family history of colon cancer. You know, unfortunately, this is false. It's very important that people understand that even without symptoms, someone can be suffering from colon cancer. And it's very important with the current diet that we have. Despite family history, we are all prone to developing colon cancer. And that's why we take the steps by performing colonoscopies or other reasonable tests like stool studies that can help determine whether or not you have colon cancer. The prep for a colonoscopy is unbearable. There are a lot more newer alternative medications that we have to make it seamless for you to undergo your procedure. The new medication that we have can be given orally, and if you choose, they can be given through solutions that are 2 small 6-ounce bottles. And so we work with you to make sure that the procedure is painless, but also one that's easy for you to bear. So we do want you to be able to have an active discussion with us to make sure that the procedure is right for you and the solution that we're picking is right for you. If polyps are found, it means I have cancer. That's not true. The vast majority of polyps are benign, and that's the way we want it. We want to be able to catch cancer before it ever forms. And we know that polyps are what turn into cancer. But the vast amount of polyps that we find when we do a colonoscopy are what we call precancerous. Those are benign polyps that on occasion can over time, in 8 to 10 years, develop into colon cancer. But we are trying to catch it before it ever turns to that, because catching it before it turns into colon cancer is a much easier fix than having to deal with colon cancer later on in life. All right, so today's class we learned a lot about colonoscopies. It's important for you to not feel intimidated, feel informed when you go to your gastroenterologist to have that discussion. We know that colon cancer is a very large, second leading cause of cancer-related deaths in America. And we are trying to prevent that. And that's the purpose of a colonoscopy. Whether it be a colonoscopy or some stool study, what's important is that you get screened. And screening helps prevent any further colon cancer. Whether you have a family history or not, it's important that you get tested. And we want to make sure that the word gets out to feel comfortable in asking the right questions. And hopefully when you see this class, you can know what questions to ask your gastroenterologist.